And this has more of an impact on impulse control. Like, so that need to, like, you're doing the best you can, you have every intention to do a good job, but something happens and you just go for the chocolate, or something happens and you just go for the alcohol, right? So we're going to talk about the dopamine response. So I think it's the first slide. It's under addictive tendencies. Yeah. So one thing about the human brain is that it is programmed to avoid pain. It just doesn't like to be uncomfortable. It doesn't like stress. It doesn't like uncomfortable situations at all. So the minute something happens, it's finding a way to feel better. So it very quickly assesses, what do I know makes me feel better? Like, what in the past have I done that has alleviated my anxiety? Well, chocolate does it, wine does it. So, your brain automatically reaches back. Oh, that feels good. And it has it. And what is released in that moment is a chemical called dopamine. And dopamine is another neurotransmitter that makes us feel euphoria. So it's the neurotransmitter that's released when we're falling in love. You're just like so happy, and that kind of can go on. And we like that feeling. So in a moment of discomfort or pain, our brain is looking for relief. It looks for something that quickly hits that dopamine response and makes us feel better in an instant. So anybody that's ever had chocolate out of stress knows that it immediately after they have it, they feel momentarily better, right? It just alleviates that, right? So it's a quick response. It's habitual. You can't pull it. You can't rein it in. You can try to will yourself. You can try to utilize willpower as a way to avoid chocolate and alcohol. But willpower doesn't work that way. Willpower is more effective when we have a deadline to meet and we only have a certain amount of hours to do it. We can gather willpower in order to accomplish that, but we cannot utilize willpower as a way to keep us from doing something that we habitually do. The only thing that we can do is try to create a new pathway to dopamine in the brain that competes with this habitual response, okay? So again, stress, terrible feeling. Our brain looks for a dopamine response, and it looks in the archives of our mind, well, what gives me that feeling? Chocolate and alcohol, or whatever it is, drugs, food, and I want that. Even if on the other side of that reaction, I hate myself for doing it and I hate the way it feels. My brain doesn't register that, it just wants me to feel relief. But Mike, you could probably answer this question because I have nobody else to ask that's listening. Taking care of yourself and feeling good has its own euphoric feeling, has its own feeling of pleasure. Would you agree with that?
Absolutely.